Good afternoon ได้ยินนะครับ Good afternoon the participant welcome back after lunch to the last session of the conference today we will welcome all the dean of the faculty and the hospital in the health science center to give us the multidisciplinary approach for the COVID-19 situation that we already know about the pandemic of the COVID-19 affect a lot to the whole country, also in the all the health science centers. So we would hear the thing that happen here in the health science center and also what we do and we should do in the future. The first that I would like to introduce to give the talk about the COVID-19. Here is Associate Professor Dr. Dilok Piyayothai. He is the Dean of the Faculty of the Medicine, Thammasat University. Please welcome Professor Associate Professor Dilok. Please.
In the next 5 or 7 minutes, I will share our experience of the Faculty of Medicine in the COVID-19 era. We all know that COVID-19 affects a lot to the society, not in only the healthcare system, but in every aspect of the society. So in the role of the Faculty of Medicine, the main mission of our faculty, as we might know that we responsible for the academic affair, research affair, and healthcare service affair. But for our spirit of university, you might know about the word of Thammasat for people. We have to be responsible for taking care of the people in the society as well. So I will share our experience in the COVID-19 that cover in every aspect that we are responsible for. So the first thing I like to share is about the main mission of our faculty, about the teaching and learning. In the past year, we encourage our staff and push them very much to apply the technology in our teaching and learning aspect, but it's very hard to the staff, to the student to apply this in the past year. But since the COVID-19 start early last year, in the policy that we have to prevent the spreading of the disease, in some protocol we have to keep distance from each other. We have to protect ourselves from infected and protect the other from spreading of the disease. So the learning will be a problem if we cannot manage it very well. So online teaching, online learning was the answer for the system at that time. So in in only a few months only that we can apply technology in the system is very faster than we expect. Because as I mentioned that we try very hard for years for applying this, but it not very successful. But it success in only a few months after COVID spreading. So online learning and teaching, our staff, our students are very familiar to the system now. We can apply the technology as, for example, the lab demonstration online, teaching online, or the chapter of the e-learning that we get much and much more in the past months. So this is the first example of the experience of our faculty. The extra from the learning and teaching in the faculty, we have some mission about teaching the people, giving advice, giving information to the people outside the faculty as well. So we have a channel in the YouTube to give information about the COVID-19 to the people in overall. We have a session about how to prepare ourselves to be very safe from COVID-19, how we can interpret what we learn, what we hear from the news about investigation of COVID-19, what about the vaccine. So the knowledge that very difficult for people, we make it easier for people to understand very well via the YouTube channel of the Thammasat medicine TU, or in Thai we call พบหมอธรรมศาสตร์ or in English meeting with Thammasat physician. That's the channel that we can communicate with the people in the society. And the role of our faculty is teaching the people in the faculty as well. We try to be the example for the society, how to prevent ourselves from spreading or infect with COVID-19, how can we apply the protocol for our staff, how to work, why we have to keep distance from each other, how to keep the hygiene that safe from COVID-19. This is the way that we communicate with the people in our faculty. And the other thing, we cooperate with the other leading medical schools in Thailand, such as Sirirat, Ramatipadi, and Chulalongkorn. We create a channel for the people to COVID-19 via telephone, via live, or via the Instagram, for example. That's the way we serve the people. And of course, I myself, as working as the committee or advisor to the policymaker in the country, we cooperate with the other faculty of medicine in Thailand to give advice to the government how to implement the protocol to protect our people in the country from COVID-19. And as you know, that we worked very hard early last year, and we continue the protocol for several months, and we can control the COVID-19 very well. And we are ranking as the first 5 country in the world that we have the best practice in COVID-19 prevention. So this is the example that we work with the other organization in the country. And in the other aspect of our mission about the research and innovation, the faculty keep the funding for the staff and students to do the research about the COVID-19. And this is the example of the publication in the Scopus database. We have a study about the psychological factor of the people who are affected by COVID-19. We share some experience of the working in the Thammasat field hospital, and some paper talking about the indicators of severity of COVID-19 by exploring the gastrointestinal symptom, how to interpret it about the severity of COVID-19. This is an example about research work of our faculty. And the third thing is about health service. We work very close with Thammasat University Hospital. We create the Thammasat Field Hospital altogether, and our staff, our instructor, especially the one who experience in infectious disease control, in chest disease, work with the Thammasat University Hospital very close, and they are volunteer to serve people who are affected by COVID-19. This is the major role of our faculty. But the last thing that I like to tell you all is about the extra from the main mission of our faculty. The most important thing is about taking care of our own people. The Faculty of Medicine, Thammasat University, launched the policy, the protocol, how to taking care of our people, such as the instructor. I provide the protection device for the staff, for the instructor, for the student. We provide the money to health because as we know that the COVID-19 affect everyone very hard at that time. We are all suffer in every aspect of our daily life. So we have the policy to help the people in the faculty. We provide the insurance for COVID-19 for everyone. We provide the fund for everyone to do the research, to provide the IT equipment for online learning, for working from home policy. So this is what we did in the past year for COVID-19 confrontation. And last year, we expect to celebrate our 30 years old anniversary last year, but instead of celebrating, but we have to suffer and fight with COVID-19. But the best thing happened as well. We can get through the disease very well. We were very happy all together and hope that we will get past and everything will getting better and better from now on. Thank you very much.
Okay. Thank you, Ajahn Dilok, for giving us sharing about the experience to deal with the COVID-19. Dr. Dilok still stay with us until the end of the session to answer the question. So we will come all the question. You can print out the question into the chat, and we will be gathering the question and get back to the participant again. So we go on with the second speaker. The second speaker, she is the Dean of the Faculty of the Public Health in the Thammasat University, Associate Professor Dr. Sasitorn Taptagaporn. She will give the multidisciplinary management of the COVID-19 in Thailand for us. Welcome, Dr. Sasitorn, please.
Thank you. Good afternoon. This is my great pleasure to share with you on the topic of multidisciplinary management of COVID-19 in Thailand. As a representative of Faculty of Public Health, we have the role in prevention and control of all kinds of diseases, both communicable and non-communicable disease. And of course, we learn a lot from the case of COVID-19 this year. In terms of multidisciplinary, we have experience in both official and unofficial multidisciplinary management of COVID-19. Let me talk with the left side, the left-hand side concerning official multidisciplinary management of COVID-19. It is the good timing to exercise the Communicable Diseases Act, BE 2558 or AD 2015, because this act states and authorized the appointment of 3 levels of communicable disease committees. One is national level, National Communicable Disease Committee. The second one is provincial level, Provincial Communicable Disease Committee, and the third one is Bangkok Communicable Disease Committee. Let me talk about the national level committee that consists of several ministries and concerned parties. The chair of the committee is the Minister of Public Health, and the secretary is the Director General of Department of Disease Control. And the several ministries that concern is Ministry of Defense, Foreign Affairs, Transport, Interior, Labor, Education, Public Health, together with Medical Council of Thailand, Thailand Nursing and Midwifery Council, the Medical Technology Council, and private hospital associations. For the right-hand side, for unofficial multidisciplinary management, we found that in official management, they can synergize the impact of the management system a lot. It is a civil society organization, village health volunteer, NGO, private enterprise, and people or civil society. And with the experience last year, we found that this unofficial management gives the key success to stop COVID-19. Can you click for me? No, back. One slide back, please. Okay, let me show you the photos of activities in the community. The first one is, this is official management concerning public health officers and local administrative organization. They went to the community and do laboratory screening and investigation. The next one is village health volunteers that they are in the community to help community screening, and this is the key success in case of Thailand. I think this is only Thailand that have village health volunteer working closely in the community. This photo showing NGO work, for example, Supanimit Foundation, they have Burmese translator and to do home visit and give health education to the Burmese workers in Thailand. And the last photo showing here, what you can see here, of course, this is the monk. Every time we have crisis in Thailand, of course, the victim and the people who get the effect of crisis, they got a big trouble of mental health. So the monk can go to the community and give in terms of psychological support. Instead of the Department of Mental Health also give a big hand to that community also. Let's see my last slide. I would like to share with you the National Health Assembly in Thailand. And last year, our faculty have joined and helped handle this assembly in Thailand on the theme of participatory health crisis management in case of pandemics, not specific in only COVID-19. The National Health Assembly is the process of the private and the related public agency, government, to join together and have the forum to share experience and knowledge, to learn to each other and come up with the healthy public policy. And the last year, National Health Assembly gave the 6 important resolutions to us. The first one is the relevant authorities should integrate management to prepare resources of the health service system. And we should call for the international cooperation and build strong engagement from all sectors in order to manage the health crisis by using lessons learned from COVID-19 pandemic. The second resolution is to manage communication, public relations, and information systems in order to communicate accurately, quickly, and timely, because we found a lot of infodemic that give the fake news a lot. The third one is to provide adequate manpower and infrastructure for surveillance, disease investigation, autopsy, prevention, treatment, and control of the spread of the disease, and monitoring the situation and trends of the outbreak. The resolution number 4 is to set up measures to reduce health impact that also not only the impacts of health, but also economic impact, social and environment impacts that occurred during and after the health crisis. Number 5 of the resolution is to create mechanisms and policies to support knowledge management, research and innovation development in order to create new knowledge, timely and innovations in preventing illness and death from the pandemics. The last resolution is to provide health networks, civil society organizations and related agencies in promoting and campaigning for people self-care to follow the guidelines for prevention and control the disease strictly. All 5 or all 6 resolutions are in the full report and sent to the related agency to go in the practice in the future. Thank you.
Thank you very much, Dr. Sasitorn, to give us the overall the policy for the pandemic in the country. So let's move to the next speaker. The next speaker, Associate Professor Dr. Thiranutha Niratisai. She is the Dean of the Faculty of Nursing, Thammasat University, to give us the disciplinary management of the COVID-19 in the Faculty of the Nursing. Please, Dr. Thiranutha.
Thank you very much for the introducing, and good afternoon, everybody. It's my great pleasure to have a chance to share experience from Faculty of Nursing, Thammasat University. For Faculty of Nursing, according to the review and our point of views, the pandemic of COVID-19 affects the pandemic of COVID-19 affects the disruption of education system, change in workplace and work system, and also affects the psychological health problems may be caused by lockdown or curfew policy, or maybe loss of job and economic effects. The people may be respond by having infection fear, anxiety, and depression occur in our student, staff, and the person in community. Therefore, all of these changes brought to pressing needs or challenge for us to innovate and implement alternative way of education strategy, and also to develop a project or a new model to help the student that can learn safely and happily, and also help the people to adapt that in this situation, stay healthy and safety in new normal. In this occasion, I would like to present the major strategy management or the level, and the student can learn and practice as scheduled and can graduate on time. So we decide to have the teaching and learning platform, and also have many kind of method of teaching and learning by using technology, such as Microsoft Teams, of learning like a presentation, workshop, mapping, and case presentation. Certainly, we have to apply and using the social distance classroom and also the public health measure to prevent the COVID-19 infection. We also regulations with the collaboration with the Thammasat hospital, such as the regulation that the student have to come back from home and evaluate or assess the TU COVID list of COVID-19, and also the student have to do the self-quarantine for at least 10 or 14 days before going to practice in the clinical practice in the hospital. And during the practice, the students have to comply with the public health measure very strictly, such as wearing surgical masks all the time. During practice, maintain the social distance and washing their hands regularly. Moreover, the students have to continuously monitor their temperature and observe any abnormal change that may be occur. In this way, our students can learn and practice happily and safely and can practice as scheduled. And in the other way, the management that we have did in the community level, one of faculty developed the project. This is the name of the project is the University to Tambon. This is an economic integration project funded by Ministry of Higher Education, Science, Research and Innovation. The purpose of this study is to develop and initiate the career in the community, to create and develop a creative economy. This is like an increased tourism in the communities, to use knowledge, helping for communities service, like a healthcare service via the technology. And the last one is to promote the circular economy. This project is operated by Dr. Eguma and her teams. And this is also the activity that integrate the practicum of the master nursing student in psychological and psychiatric nursing to healthcare team, which implement in the Tambon in Sam Kok area. And also they do the research project at the same time. What do they do in this project? There are 4 sectors of the project, but we focus on the healthcare service. This project, they do starting with the need assessment and screen the mental health of the people. And after that, they launch the telehealth and the chatbot for the people in the community. The next slide. After the survey, we know that the people in the community need how to maintain or prevent or promote their health and wellness, and how to do the stress management, and how to take care of the older adults. We do the telehealth and chatbot about the education and how to take care of the older adult, and to train in occupation in community to reduce living expense and increase income. This is all the project that we did. And thank you for your attention.
Thank you very much, Dr. Thiranut. Then I will move to the next speaker. She is the faculty, the Dean of the Faculty of Allied Health Sciences, Associate Professor Dr. Paiwan Sattanon. She will give a talk about share about the COVID-19 experience from the Faculty of the Allied Health Sciences. Please, Dr. Paiwan.
Thank you, Dr. Sombat, for the nice introduction, and good afternoon, everyone. As the Dean of the Faculty of Allied Health Sciences, I'm here to share what we have experienced and learned in the situation of COVID-19. The Faculty of Allied Health Sciences, Thammasat University, as one of faculty in Health Sciences Center, healthcare profession. Currently, the faculty offering 6 bachelor degree programs covering medical technology, physical therapy, sports and exercise sciences, sport management, sport coaching, and radiological technology. We also offering several postgrad programs, including biomedical sciences and forensic sciences. The faculty continues to grow with the diversity of professions, staff, and wide range of research interests, as well as the standard healthcare services. In 2020, there were wide-ranging planned activities which turned to be a challenge in the situation of the world COVID-19 pandemic. The situation led us to consider ways of responding to challenges and ways to find opportunities. And as an academic organization, our key roles are to provide high-quality education and to create high-standard research, as well as to promote research innovation for community. Not only for the faculty's staff, but for all our students. I admire their determination, their effort to adapt, adjust, and overcome all the challenges in this uncertain situation. A number of activities, both academic and non-academic, have occurred as a new normal activities, and we are different or new kinds of technologies like as the online or virtual approaches successfully. And one of these is the opening of our AHS Student TU channel on the YouTube. So feel free to follow and subscribe to our channel. In terms of research and innovation, last year, 5 of our laboratories, including molecular microbiology, drug research and development, hematology, and molecular diagnostic laboratory, received Thammasat University Expelled Standard Laboratory Award. And all the laboratories serve both for teaching and research activities, and not only for our students and staff, but can be shared to staff from other faculties as well. There are several research related to COVID-19. For example, one of our rising researcher, Dr. Jirapong, received funding from the National Research Council of Thailand for his project on the identifying antigen for novel coronavirus and developing antibody detection kit. And Dr. Korn Anong, whom has her expertise in respiratory physical therapy, received funding from the National Science and Technology Development Agency on her project in developing the respiratory muscle testing training device. Another important part of the faculty is the healthcare services, which consists of 3 units, including medical technology research and service unit, physical therapy and hydrotherapy unit, and sport science and sport rehabilitation unit. Our healthcare service serves not only a high standard clinical service, but also serve as a great resource for research and academic activities. The molecular technology, the medical technology research and service unit has achieved the ISO accreditation, which guarantee the quality, customer satisfaction, and recognition of the competency of laboratory. Regarding the COVID-19, since last year, the unit served real-time RT-PCR for detecting the virus caused the COVID-19, in which we was the first 8 laboratory accredited proficiency testing by the Department of Medical Sciences, the Ministry of Public Health of the country. Currently, we also provide a screening test for COVID-19 by antibody rapid test at the on-site service. For example, at the graduation ceremony of Thammasat University, State Railways of Thailand, Ministry of Education, Jan Kasem Rachapat, and Sukhothai Thammathirat Open University. The other two units of the healthcare services, the physical and hydrotherapy unit and sport science and sport rehabilitation unit, have their role in health promotion and rehabilitation, in particular in pulmonary endurance and fitness. However, during the situation of COVID-19, when personal contact has been avoided, could be a limitation for delivering health promotion activities. Therefore, the faculty have support health promotion activity delivered by new normal activities as well as on virtual or online approaches. So last month, on the occasion of the 25th anniversary of the faculty, ICTUHS channel has opened, and please feel free to follow and subscribe to our channel too. So that's all what summarized from our experience during the COVID-19 situation. Thank you.
Thank you very much, Dr. Paiwan. So I move on to the next session from the Dean of the Faculty of the Pharmacy, Thammasat University. He is Associate Dr. Aram Jesadayan Mehta from the Faculty of the Pharmacies. You will share with us about the experience of the COVID-19 in the faculty. Please welcome.
Good afternoon, and thank you, the organizing committee, for the invitation to join this conference. I'd like to take this opportunity to introduce to the audience some of the pharmacists' role during the COVID-19 pandemic. Having this problem, whether what does the pharmacist do during the COVID-19, I have done some PubMed search and using the terms like pharmacist or pharmacy and coronavirus or COVID-19 or SARS-CoV-2 and role or responsibilities. Surprisingly, I come up with 773 articles on the PubMed. Among these articles, 681 articles were excluded because on the review of the title and abstract, and 92 articles were reviewed. And because of the limited time span I have, so I have chosen 6 articles for review. So what are the pharmacist's role and responsibility during the COVID-19 pandemic? I have found a lot of studies, a lot of reports from the US, United States, from China, because China is the first country to have the COVID-19. The Middle East, surprisingly, like Jordan, Saudi Arabia, Europe, Asians, and I'm very glad to see that there's one paper from Thailand. And most of the report of the study are reported for pharmacists in the hospital or community pharmacy settings. So what are the reported roles and responsibility of pharmacists during the COVID-19 pandemic? The first one that I have always seen in the papers is they ensure effective supply of medication and drug storage management. Of course, this is the most important role of pharmacists, especially antiviral medication like favipiravir and remdesivir, which is often used for patients with COVID-19. And this is also applied to our country also. Pharmacists have to make sure that in certain patients, if they really need remdesivir, they really have to have it. The second thing I have been observed in these papers are telepharmacy services. Telepharmacy services are provided both in hospital setting and community pharmacies. So not only hospital, but also community pharmacy, they have done the telepharmacy practices. They also provide that information to the healthcare professional, and they're trying to correct misinformation to patients and customers about the COVID-19. And I'm sure that at this time, they're probably going to have to correct misinformation about the vaccine. They have to prepare sanitizer and disinfectants as an extemporaneous preparation. I believe that during the first round of epidemic, we're not prepared enough to have enough sanitizer and disinfectants. So pharmacists have to prepare them freshly, like alcohol gel, to disinfect the surface and the equipments. And I'm surprised to see that a lot of study have reported that pharmacists are also included as a member of emergency preparedness and emergency response team. And to look further, I have found that in Thailand, pharmacist is already appointed as an emergency operation center member, EOC. They have to look at the supply of medication and manage the medication if that deemed necessary to the emergency response. And finally, they are appointed as a part of a clinical trial team, and I hope to see this in the future in Thailand too. So telepharmacy is it's not new. It has been done for quite some time. So I'm looking at the Thai Pharmacy Council statement on standard of telepharmacy practice. The Thai Pharmacy Council have stated that this telepharmacy practice needs to be conducted by person who licensed to be a pharmacist. Then during the telepharmacy, they need patient registration, they need record of patient history and service that they provided. They need digital technology to provide patient distance service, and they need to record all the service that they provide. And confidentiality is emphasis. Patient interview and drug delivery service. They need to control the temperature. The right person needs to receive the medication, the tracking system, and the prevention of medication loss during the delivery service. I think that all the pharmacists need to know this. And the last slide, I like to talk about one of the paper from Thailand. I'm very glad to see one of the paper from Thailand. Clinical pharmacists in at Lama Tipadi Hospital also provide pharmaceutical services for COVID-19 patients. They state that they use telemonitoring using the computerized patient order entry or CPOE system. What are they doing? They are doing therapeutic drug monitoring, like they monitor the anticoagulant use. They did the individualized drug dosing for special population like obesity patients, patients on the CRRT, ECMO, and hemoabsorption. They detect drug-related problem in critically ill patients, and also they did the medication reconciliation in patients with many underlying diseases. And lastly, I want to summarize. Pharmacists participate as a healthcare professional in multidisciplinary team in fighting with COVID-19. Several roles and responsibilities have been reported in the literature. And I hope that pharmacists will maintain their professional standards of pharmacy practice. And they have to remain up to date on the relevant information during this pandemic. Thank you.
Okay, thank you, Dr. Aram, for the sharing of the experience from the pharmacy. The next speaker is Assistant Director from the Thammasat University Hospital, Professor Dr. Kongkiet Kunkantalakorn. He will share the good experience from the management of the COVID-19 in Thammasat University Hospital with us. Please, Professor Kongkiet.
Thank you. I'm acting on the behalf of the hospital director, Dr. Prahat Udom. I would like to report the performance and then our experience in Thammasat University Hospital regarding this COVID-19 situation. Our hospital is a 700-bed hospital. It's a tertiary care hospital. And then we have the dedicated resources for the COVID patient. We have negative pressure, cohort ward, isolation room, and then we have the extended Thammasat University Field Hospital. This is our current situation. But before what we have today, we have many obstacles and opportunities. When the outbreak started about over a year ago, we kind of panic, and then we need to have the war room every day, okay, at least for the first 5 or 6 months, and then after that we have come down to once or twice a week. At the beginning, there's some problem about the diagnosis, especially getting the specimen or the swab from the patient, and then we have to build our infrastructure rapidly to meet the demands and or potential outbreak in nationwide. Then we need to build our capacity first. This is the updated or the new modular unit for our swab unit. This unit has been highly donated from Her Royal Highness Princess Mahachakri Sirinthorn via Achai Patana Foundation. This helps us a lot for getting the specimen safely for patient and also for the healthcare personnel. This is an EID clinic, which is the outside of the main hospital in order to screen patient who has a high risk or patient under investigation to be screened and treated similar to the ARI clinic elsewhere. But this has been newly built and renovated from the old building of TMB Bank. Regarding the intensive care unit, this is the new respiratory care unit. We call it Ban Pu Respiratory Care Unit, which is donated from the Ban Pu and Mitpon company. We have 12 beds for the patient, and then we provide the service for severe COVID patient, and then we still having COVID patient in and out of this unit. This is dedicated to the patient not only in our hospital, but we have get a lot of referrals from other hospital or other regions from Thailand. For regular patient or non-severe patient, we have renovated our hospital with the dedicated wing, at least 3 wards to meet with the patient demand, whether it's an isolation room, negative pressure, or a cohort ward for observation for my patient. Look at the number for the current or the second episode of the infection. We have cumulative cases coming for screening about 3,200, patient under investigation for 1,400, which is a lot of number comparing with the previous episode of outbreak. In 2 months, we found the COVID positive patient in our hospital, our screening lab, 47 patients. This success is not coming from our hospital personnel itself. There's a lot of donation for COVID patient and our personnel, whether it's coming from private or public sector, such as food, medical supply, personal items, and other things. Now we are focusing on the Thammasat Field Hospital. It has been open since 23rd of March 2020 and has been operated for 2 months. And then we close it down with the second episode of this outbreak. We opened it again in January, and we just recently closed it 2 days ago. From the first outbreak, you can see that the COVID positive who has been referred to the field hospital is only 38, but this episode, 2 months, we have 271 patients, and the total cases, including the PUI, is 311. This number is quite a lot because each patient stay in the field hospital at least 2 weeks, sometimes up to 4 weeks. That means we need to spend a lot of effort, personnel, and dedication from all the patients and personnel involved. In order to make this field hospital work, the re-innovation and then the innovation from other places also are helpful. We need to have the internet or CCTV or connecting every service all together to make it possible. We also have the backup. That means our main hospital needs to be a backup for the patient as well. At least we have come a lot for the current situation. Nonetheless, this pandemic is still ongoing, and then our commitments for patients and the society remains high. We will continue our effort and doing everything for our patient, whether it's today or tomorrow. Thank you.
Thank you very much, Professor Kongkiat, for sharing us the experience from the Thammasat University Hospital. And please give the excuse for the two deans from our Health Science Center, Professor Dr. Adit Tassanalong, the Dean of the Chulaporn International School of Medicine that cannot appear here, and also Associate Professor Dr. Samleung Inkram, the Dean of the Faculty of Dentistry, that are not able to show up here also. But anyway, Professor Adit just have the short video clip to share us about the experience of the COVID-19 from the CICM. Please watch the Professor Adit Tassanalong, the Dean of Chulaporn International College of Medicine. Today, I am honored to be able to introduce all of you to my colleagues. Let's start off with getting to know CICM first. Our vision is to become a high-performance college in which can produce next-generation medical professionals who are expected internationally. Moreover, our mission is to transform these medical professionals through medical education, research, and healthcare services. The ICM motto is Great ICM and James GEM. Starting from the beginning, CICM has made a plan for our digital system development, in which consists of 5 steps. The first step is using mobile-based education, and the second step is smart classroom. The first step is digital maturity and skill solution. The fourth step is smart faculty and innovation. The fifth step is smart healthcare services. You can see the first step and the second step have already been accomplished. Our students are able to learn and study anywhere, in any time, through many platforms provided by the ICM. We are currently moving on to the third step of the development, Advanced Digital Simulation Center. However, COVID-19 came along, so how has our plan changed to do the fact that we haven't gone through a global pandemic like this as modern societies before? The most important thing to change in this crisis is our mindset. The mindset is very important to change. Everyone is probably used to do things the old-fashioned ways. But as you know, because of global pandemic, it's impossible to do that. Each person must compromise in order to move on further. How can we do that? CICM starts by teaching online class along with working from home method. And by doing some, CICM has created a digital disruption for all of staff and students.
We have been used so many platforms, starting from Microsoft Teams, Zoom, WebEx, and other several activities. Our students can study anywhere and anytime through Thammasat University Moodle system. They can use the learning resource during outbreak of COVID-19. CICM also are real-time conference teaching by using the newest technologies, for instance, anatomy table and a pathological scanner. By all means, we have created a smart classroom for all of our students. In this smart classroom, we have focused on team-based learning also. Not only we have done this online teaching, but we also start doing online examination as well. Although there were some problems here and there, the overall system result can come out brilliantly. So we have planned to develop a much more successful and convenient examination system. We developed guidelines for staff and students on online examination. May already know, the telemedicine has been one of the most talked about topics in the century. That is why CICM plans to improve our digital health platform in the near future. We have planned to do all of this in the new hospital at Thammasat University, Pattaya campus. Lastly, because of the pandemic, some of you may think that this is the end of the world. There is no way we are getting out of this. Nevertheless, I would like to think of it as an opportunity to push myself and to push my limits furthermore into making the CICM better. Thank you very much for your attention. Please don't hesitate to contact me if you have the questions. Enjoy the conference and have a happy time.
Thank you, Professor Adit, for the video clip. And we come to the end of the session. We have some questions that we would like all the deans to give their opinion and their answer for the question. So you know about the new emerging already, the term of the new normal. The new normal practice is kind of the standard practice in our society now. So we would like to know that how the new normal practice would affect to the faculty, or what is the new normal practice that should be implemented into the faculty. So I will start with the Associate Professor Dilok first about the question, please.
Okay. I think the terms of new normal, we are very familiar to this term since COVID-19 pandemic. So I think it's only one example of the situation that we have to confront with. We all know is that nothing is impossible, because the emerging disease like this, we only learn from the text that we have a pandemic of Spanish flu like 100 years ago, and we never think that we will confront such a situation in our life. So this is I think that the key key success factor that we can live with the problem like this. It's not only one situation. We have to adapt ourselves. We have to cooperate with each other. We have to learn. Continuous learning is very important, so we can learn from our experience. For example, after the COVID-19 pass, I think we should have a lesson learned from COVID-19 and make the knowledge for the later generation how we can cope with this situation. So I will not go in depth about the new normal in the question, but I just like to share that the important thing that we can get through it is our cooperation, our adaptation, our continuous learning.
Okay, thank you, Dr. Nirok, for share the idea of the new normal. So how about the public health in terms of do you have any kind of idea, Dr. Sasitorn, please?
As the Dean Dilok suggested, as public health personnel, and we have to teach students also. So may I separate into two types of prevention and control. The first one is personal life. We have to be a good role model to the others and to the students. So personal life means hygiene. We have to keep on hygiene personal, like eat good food, good cooking, hot food, use our own spoon when we eat something with the other persons, and always washing hands. And in terms of public health, if you know the route of entry of the disease or microorganism, you just close that route of entry. And in case of COVID-19, you know that the microorganism can get through the body by breathing, by mouth, or by touching the hand to the microorganism, and use that hand touch our face, the mouth, nose, or eyes, that the disease can transmit it to our body, then prevent those. For example, using masks, always washing hands, something like that. And this is the way of practice to prevent and control the disease. And as the working life, since we teach students to be a public health personnel in the future, not only to be a role model, but students should learn and experience the real life that have occurred already. The COVID-19 is a very good students to them, and they learn how to spend their life with those diseases, and they know how to prevent and control. And this is our role in public health. Thank you.
Yeah, thank you, Dr. Sasitorn. And also, nursing is one of the important practice that we would like to know, to hear from Dr. Thiranut, the Dean of the Faculty of Nursing, about how about the new normal nursing or something that nurse can be changed.
Okay, for the pandemic of COVID-19 just passed, and we have faced, so we learn a lot about how to prepare ourselves, and when it occurs, it's important that we have to inform our students and our personnel and communications to prevent from the psychological that may occur, like a fear of infection. So right now, I think all of the personnel and staff know about how to do that. And I agree from public health, Dean of Public Health, that the personal hygiene is very important thing that everybody should be concerned and strictly, like wearing mask and social distance and something is very important for the social response to prevent from transmission of COVID-19. This is very important point for nursing. Thank you.
Thank you, Dr. Thiranut. And also the faculty of the early health sciences, they have a lot of medical personnel involved in to the treat the COVID-19 patient, and also the new normal practice for the allied health sciences should be important. Give some idea from Dr. Praivan, please.
I think from what we all have learned from COVID-19 situation since last year was like, as the Dean of the Medicines said, that we have learned a lot, like the way that we need to adapt to the situation. At the first stage of the COVID-19, it was really uncertain situation with very limited knowledge about it, and also, of course, very limited resource to deal with it. But we all have passed those phases. So I think the important thing is we need to learn what we call new normal. This day might be not the new normal for the next pandemic situation in the future, but the skill or the competency in terms of adaptation or problem solve or problem analysis is very important. That we need to know that these kinds of skill and teamwork, especially the multidisciplinary teamwork, is very important. That would lead us to overcome all whatsoever will come in the future. Thank you.
Thank you, Dr. Praivan. And also for the pharmacists, they need to learn the tele-pharmacist now, and to be the new normal for pharmacy. I think that should be important for all pharmacists over the country to learn that. Please give us some idea about the new normal for the pharmacies, Dr.
Okay, thank you. For the new normal, at the Faculty of Pharmacy is probably like all other deans have said, we still have to perform our function, being productive and doing our mission as usual. At the same time, we have to protect ourselves from contracting the disease. And so we have adapt to a lot of things like teaching and providing academic services. We nowadays provide academic services to the online services, like this conference, for example. So I think this is quite new to the Faculty of Pharmacy, but we learn how to do it better and better. And I believe that in the future, we're going to perform well in terms of providing information to the profession like pharmacy, like how they should perform their function, and also to the public. So I think this is the new normal for our Faculty of Pharmacy. Thank you.
Thank you, Dr. Alam. And finally, for the hospital, that is one of the most
I think the first impression is about the contact precaution or universal precaution. I think both patients and the healthcare personnel knows that they are becoming just normal, and then there's nobody worried about it, but it is a new practice right now. However, for the practice of medicine or the hospital policy, we are now adapting more and more technology into the day-to-day activities in terms of application for the appointment, computerized system for the documentation, the dispensing the medications, things like that. They're moving quite quickly to minimize the contact process, or to move the patient faster, not to spend too much time in the hospital waiting and then have the high chance of contacting the disease from someone else. The other thing is about the resource management. At the beginning, we kind of panicked that we need to provide a lot of resources, we have to prepare this and that. But now it's becoming normal that we know how to handle the situation, as well as to look at COVID as just another disease, and then we know how to deal with it. We prepare ourselves, our staff, to cope with the situation. So during the second wave is kind of just another process or another obstacle to go through, not dealing it with the panic phenomenon as in the previous outbreak. And I think we are coping with this, and then we hope to make it faster and quicker to overcome this situation. Thank you.
Okay, thank you very much for the answers that give us a lot of information. And so we come to the end of the conference. Please stay with us, and maybe for the next 2 years, we hope that we can make the conference again, and we hope that all the participants can enjoy the conference and get a lot of the knowledge from the conference. We do know that the conference is now we need to pronounce that the online should be on the track, but in the next 2 years, maybe we can come together to join and be with the face-to-face again in the next conference. We hope. Thank you.